to our doctor's office, a lot of times they do not take them back. So this is an important resource for the general public to have. And desperate for the proper and affordable disposal, individuals have been turning to tossing them sometimes in our green boxes, which cause a biohazard to our officers. With the strict handling and disposal methods overseen by the federal law, there are challenges associated with being able to have one of these boxes here, and required certifications as well as credentials to handle it, not only handle it, but transport it, and the disposal have to be done outside of the department. So, in partnership with Maricopa County Attorney Bill Montgomery's office, we were able to provide this much needed resource to the general public. Whether we're talking about legal or illegal use, we can't turn a blind eye to the fact that proper disposal of these things is vitally important in keeping our environment clean, keeping our environment safe, keeping this out of the hands of our teens and our kids, and as just a matter of public health. While this is the first box of its kind in the state, we hope that this collaboration will encourage other police agencies throughout the state to come together and do similar programs and resource box available to them as well as a resource. I would now like to invite Deputy County Attorney Addison Noggle to the mic to give a few comments, and then we'll hear from Stephanie Siete from Community Bridges, who's here as well, Dahlia Williams from Drug Free Arizona, and Ted Huntington with the Gilbert Chandler Substance Abuse Task Force and the RX Initiative. Addison.
Thank you for being here today. I spend most of my days prosecuting drug crimes. I spend much of that time balancing how to appropriately discourage drug use and how to help drug addicts overcome their drug abuse. And although this project is helpful for both legal and illegal syringe users, the implication and effect it'll have on the illegal drug community must be noted. Used syringes are dangerous. They can carry and spread diseases, and if not properly disposed of, can be a hazard. Typically, I see two types of drug cases that involve syringes: meth and heroin. Meth and heroin are two of the most addicting drugs, so I handle a lot of those cases. Allowing people to get rid of the syringes will allow them to let go of a lot more than a little bit of metal and plastic. It allows them to get rid of the device that allows for their addiction to flourish. This program has been funded by RICO funds. RICO funds it's money that is gained from asset forfeiture that is dedicated to fight and prevent drug use and organized crime. So this partnership is incredibly important. Maricopa County Attorney's Office is happy to partner with Gilbert and to have the syringe disposals available for the public. This is the first public drop-off in Arizona, and this program is a small way that we can make a huge difference while we continue to have so many people fighting addiction. Thank you.
Next we'll have Stephanie Siete from Community Bridges.
Thank you and good morning. I think this is so important for our community to know that these boxes exist. Needle disposal is a public health concern. People just don't know how to dispose of this stuff because they don't even know that it's a problem. It's commonly overlooked. So I think what I really wanted to do was share some data that I had to look into. And we found that each year approximately 9 million syringe users will administer at least 3 billion injections, outside of healthcare facilities. Many of these users are unaware of how to properly dispose of these needles, and they throw them in the trash, they flush them down the toilet, and you can see the potential risk of injury for many people who could be susceptible to disease like hepatitis B and C, HIV, and we definitely want to prevent that. This is not about what drugs people are using. You know, I talk about drug use, drug abuse all the time. we have to understand that many people are managing their health care conditions, and not just people, pets. I mean, there's a lot of ways that needles are getting used in this community. And yes, there are those that are going to abuse drugs through injection. So I think it's just really important that we know where to properly dispose of these. Because if needles are left, say in a park, on a counter, thrown in the trash, many people can be susceptible to getting hurt by this. They could get in the wrong hands. Again, I think we need to heighten awareness, right? Like, many people don't know the concern, they don't know the issue, and then they don't know where the boxes are. So we need to teach people how to do the right thing. That's why an event like this is so important. We need to reduce the problems. I mean, just like the prescription drug boxes here, people are talking about that. They know where to go. So now we need to drive them literally to the websites, to the resources that will teach them how to do proper disposal. People don't do what they don't know. It's the bottom line. So I think it starts with heightening the concern and teaching people, and then again, showing them. So thank you to the Gilbert Police Department. Thank you for everyone who's supporting this issue. Let's all do our homework. Let's all do our action steps beyond today and tell other people. I know I've already taken pictures. I plan to show people and teach them. Teach them the action steps to do the right thing. Thank you for your time.
Thank you, Stephanie. Next we have Thalia Williams, the Program Director from Drug Free AZ.
See if I need to raise this up a little bit, right? There we go. Okay. Well, I do want to congratulate the Gilbert Police Department on this great achievement, and also for responding to the needs of the community, because it's clear that that is quite a need. And this really is a great educational moment for families, and just to remind them that prescription drug abuse in general is still quite an issue in Arizona. 1 in 5 high school students have used prescription drugs to get high, so that's a huge concern. And with the average age of first-time drug use in Arizona is close to 13 years old, it's actually a little bit below that. That's also a great concern. But there is good news in that parents have a really vital role in preventing youth use of drugs. And so what I mean by that is, if they have regular conversations, not just like a one-time thing, if they have conversations with their kids on a regular basis about the dangers of drugs, their children are up to 50% less likely to use. So making sure that you are aware of the dangers of prescription drugs, sharing that with your children, and not just prescription drugs, of course, other drugs as well. So that is super impactful. And along with having those conversations, it's also important to monitor your kids' use of prescription drug medications. You know, kids might be prescribed some kind of, even an opiate, you know, for their wisdom teeth removal or for a sports injury. And so making sure that they're taking only the prescribed dose, making sure that you are right there alongside with the doctor monitoring what they're using. So that's extremely important as well. And then having those conversations and proper disposal. These 2 units right here are wonderful. Make sure you use them. So that's really all I had to say today. Again, thank you so much to the Gilbert Police Department. Really appreciate your efforts to help your community.
Next, Ted Huntington. He is from the Gilbert Chandler Substance Abuse Task Force and RX Initiative.
Good morning, everybody. How are you? It's with great pride that I can say that the Gilbert Police Department is an instrumental piece of our Chandler-Gilbert Task Force. As Mayor Lewis likes to say, Gilbert Chandler Task Force. He was here. The task force was formed in response to the community's desire to combat substance abuse and its devastating effects. ICANN and the Chandler Coalition on Youth Substance Abuse formed a committee in response to addressing the opioid medication epidemic. And then Mayor Lewis, Police Chief Dorn, John McCatton from the Senator Salmon's office, all proposed that the 2 cities unite in an effort to utilize our resources more positively and affect a greater number of people. So then the Chandler-Gilbert Substance Abuse Task Force was formed. It's comprised of a 5-sector format engaging key resources from the community, all coming together as a unified team. The sectors strategically chosen provide a full circle of resources for a variety of stages of substance abuse recovery. We have education and prevention, rehabilitation, and then recovery. And the task force also has a focus on implementing best practices and bringing change to the system where needed. There are a number of people that are involved in the task force, and the Gilbert Police Department is, like I say, one of the key members. So bringing change by opening up opportunity and doors and leading the way allows for us to collaborate together. So it's an example of just additional action steps that we can take in our communities. So I fully would believe that a lot of other police departments are going to now follow suit with the example that you've given here. So thank you very much, Gilbert Police Department.
Thank you, Ted. And actually, I've already received a couple of calls. One was from Paradise Valley, and they said, we plan on being number 2. So thankfully, it's happening, and other agencies are following suit. The Arizona Crime Prevention Association, as part of this package as well, if you go onto their website, ACPA, Arizona Crime Prevention Association, acpa.net, you'll find a Google mapping that we've done, and that Google mapping will have every single location that not only the green are available, but now the red too. The hours, the agencies, the locations, and it will pin map where you are at and your closest location for drop-off. So make sure you use that website as well. Now what we're going to do, and I would just, I'd like to give a thanks as well here to the Gilbert Chamber of Commerce. Their ambassadors and the Gilbert Chamber has come to this event as well, and they are going to help us, along with our community partners that we had speak here today, cut our ribbon. And everyone is free then to have some breakfast. And just FYI too, we do have a fundraiser luncheon starting at 11. As you see on the other tables behind you there, and we'll be serving, it's actually for one of our individuals here who's suffering from cancer. So I appreciate everyone for coming. We're going to come up front here, do our last bit, cut the ribbon, and you can speak to any one of the folks who have spoke here today on this resource, but thank you guys so much.